I'm Dr. Barry, licensed psychologist, and here we talk about true crime and psychology. Thank you so much for joining. Let's hop right into today's topic. Let's go.
Welcome. Thank you all so much for joining. I'm Dr. Barry, licensed psychologist, and today we are going to continue talking about the Lindsay Clancy case. This case is very heavy. I have an entire playlist dedicated to this case, and I'm going to go back later and edit the description of this one to make sure to include the playlist and all of those other things. So, welcome. You are right on time. I just clicked live. Today, we are going to talk about how week 5, week 4, what week is this? Is it week 5? Something like that. How this week is going so far. We are on day 2. The judge, I don't know if he's seeing the jury or if he's noticing things are getting heated and he's just like, let's break for the day. There have been a few times that the judge has just been, let's break. We have to talk about Dr. Mack and Lindsay's attorney going back and forth again. And to me, so Dr. Mack cross examination started on Friday, and then on Monday he appeared via Zoom. And there were times for me personally, the way that they would go back and forth, it made Dr. Mack's testimony for me come across less credible. Now, I think he knows his stuff. I think the attorney was trying to pigeonhole him into language or into things that he didn't agree with. And but by the end they just both seemed done. Like it was I didn't get much from it, me personally. I agreed more with the second and third expert from the state. Now, I think Dr. Mack did, he met with her. He came up with a diagnosis that was she was in a major depressive episode during the time. He was not sure about bipolar disorder. The second expert did diagnose bipolar disorder. We haven't heard the third expert's did we get a diagnosis? Oh, because he was just looking at criminal responsibility. I don't know my brain. I have notes here to check to see if there was a if they ended up doing one. Yeah. Um, I do think the attorney was intentionally kind of baiting him to not answer. So saying with the diagnosis of postpartum psychosis, knowing that this expert is going to say that's not an official diagnosis, I can't speak to a diagnosis that isn't in the DSM. But to not even say that during the postpartum period, a person could have this. Now, to me, that the expert was clear that he felt postpartum psychosis was more, if it was going to happen, it would be within those first 4 weeks, that it's more rare for it to happen later. I agree with the second expert from the state that I personally think that Lindsay had if she is diagnosed with bipolar 2, that there were adverse reactions to the medications, and that may have, if there was psychosis, that it could have been medication induced. Now, yes, she's in that postpartum period because she had had a baby within a year, but it wasn't the hormonal change of postpartum for me personally. People can think, people can, we can all think different things, but I do think what brought her in to Dr. Tufts' office the very first time was the postpartum experience of having difficulty returning to work. And this case is shining a light on women's mental health in a way that I think is needed. And I think it's a good thing. And I think the public is now going to be educated in just, okay, if I'm working with a psychiatrist with anxiety about my anxiety, I might also need to talk with my OB about anxiety too, or I might also need to follow up with my primary care physician. Having a team approach, I think, can be really helpful. And then It's just this case is just very, very hard. I'm looking at questions. I see Afton, I see your question. I'm gonna get to that second. Is it unusual for the psychosis to come on later once weaned off meds when you reacted which you reacted adversely to? So that's where the expert today, so I think he started yesterday. I could be wrong. But the expert from today, Dr. Halburn, did not believe that she was actually psychotic. I want to hear more from the rest of from the state's last expert as well, and that cross examination. I appreciated how compassionate to me. Now, if you don't like an expert or if you don't like what they're saying, to me, there were times that Dr. Halburn I thought was helping the state, and there were times I thought he was helping the defense. He 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 admitted that Lindsay did have a very serious attempt, because to me, during opening statements, the state was minimizing her attempt on herself and drawing out that superficial language from the medical experts. And so this expert was like, and he admits she was trying to get for help. She was asking for help, and that she continues to experience negative emotions, and she's continuing to grieve the loss of her children, and that she will never be the same. I thought Dr. Halburn did a good job communicating that. Now, he questioned the psychosis and some of the inconsistencies. uh I think the defense did a good job saying, wouldn't the assessment that was closer to the time of the incident, wouldn't that be more um reliable, or wouldn't that be the better assessment versus one that was done 3 years later? I do think the jury, they might have to weigh that. But the experts later, there was more information that they were able to take a look at as well. What type of does the type of psychosis matter if she was indeed psychotic and unable to control herself? No. So the type of psychosis, if it's psychosis that's a part of um bipolar disorder, bipolar 2, typically, I don't, because normally psychosis, I've seen psychosis more with bipolar 1, but there could be adverse effects with medication. I am The way that Dr. Halburn and some of the other doctors, the doctor from today as well, the way that things are being described, um, and I've always wondered how that male voice, any auditory hallucination was only experienced that one day, and that she listened to that voice and that she did it, but she had intrusive thoughts to harm the children in the past. So I always personally wondered if it was more of an intrusive thought. Now, an intrusive thought wouldn't sound like a male's voice, and so that's where you have to think about, okay, so why would somebody be saying that it was a man's voice? And I think Dr. Halburn had an opinion as to why he thought she was saying that. um, Breastfeeding as well can definitely impact hormones. That is correct. Yes. And so the Kifi D trial is a great, like, if you want to come away and not have to deal with just the heaviness of this trial, the Kifi D trial, and Emily D. Baker, she is streaming that trial. And I've definitely been looking into that. Lizzie mentioned, I was shocked. She told him the voice only happened once on that day, versus the claims in the civil suit of them happening all day, every day for weeks. So that's where, and I don't know if I don't know who that was told to, because even the defense expert didn't say. So he said that she had been having intrusive thoughts, but as far as the voice, I think all the experts have said that male voice was only on that day and it's never happened after. And that, yes, there were these intrusive thoughts. Yes, there were possibly, because delusions could also be psychosis. And I don't know why the defense didn't lean into that more. Because, but I think the state was going to rebut that with her fears of, the children being taken away, or her concerns, the state is going to say that wasn't a delusion, that was a real thing, that it wasn't a false belief, that it was true. I was I was kind of surprised the experts didn't lean more into, is it possible that that there were some delusions as well. All right. And so hi. So, once again, I want to finish up with Dr. Mack. He did talk about evaluating Lindsay at the same time as Dr. Halburn. And I mentioned that when I was on inpatient psychiatric units, now that wasn't forensic, but even for some forensic assessments, if multiple disciplines were going to meet and ask very similar questions, we would sometimes do the interview together because the person isn't having to go through all of this information 3 different times. Because if Dr. Mack had met with her and then Dr. Halburn and then the doctor from today, if each one of them, it's just you're having to go through all of these things over and over. They were with the same consulting group, and so they did meet together. Now the jury might question, um, the jury might have an issue with that. I, as a professional, I didn't have an issue with them meeting with her together. Uh, so Dr. Halburn, the cool thing, so he has some roots in Virginia. So I'm a Virginia-based psychologist. I had friends that worked at Central State and the state hospital, sorry, the psychiatric hospital that I worked at, MCV, so Medical College of Virginia. They also have a children's unit, Virginia Treatment Center for Children, and I did my pre-doctoral internship at Virginia Treatment Center for Children. My husband's asking me about ordering food. All right, I would. So I'm ordering. I'm ordering some pizza rolls. Thanks. I think pepperoni. All right. Sorry, I'm getting my dinner order. But yes. All right. Question. We're gonna pause for a question. Because the phone was evidence, she was calm and controlled. Now it's changed to everything happened after the call. Yes. Not really a question, just thoughts. I wonder if the jury is going to watch the interviews. Can y'all let me know in the chat, were the interviews, the video recordings of the interviews, were those entered into evidence? I think the defense wanted at least the one with their expert to be entered. I wonder if the jury is going to be able to watch the different versions. Okay, no, they haven't been entered, because deliberations would be like 2 to 3 days. Because if I was on the jury, I would want to see what she said. They're going to have the experts' reports, but I don't think they're going to have it. Do you think there's a meaningful difference between psychosis and being depressed? That you believed that doing this was better than letting them suffer? Both involve distorted beliefs, but the biggest thing for this case is criminally, does the person because red rum is wrong and illegal no matter what. And so I wish that um she had communicated with her providers that she was having thoughts of harming the children. That's, we can't go back. I definitely understand why she didn't. If I was her provider, I would have focused on safety. And as long as the family agreed to not leave her alone with the children, because maybe we bring the nanny back. Because the nanny was let go because they thought, oh, she's going to go back to work. And so maybe there's something else we can do. Maybe we adjust the medication. I think Dr. Halburn did a good job explaining that with severe depression, sometimes there can be this improvement where the person now has energy, but they have the energy to act on the thoughts that they've been having. And that's a huge red flag. And so I think the biggest thing is, did she understand that it was wrong? She says that she didn't. And was it today? Because Dr. Halburn, I might be saying his name wrong, but he talked about this dissociation that can happen, and that dissociation isn't psychosis. There is severe dissociation where there's disconnection, where the person truly feels like they can't, like they don't have control. That person, so an individual with multiple personalities, so with dissociative identity disorder, the most severe type of dissociation, where they truly, like there they truly disconnect from who they are as a person. uh Even individuals with that diagnosis are sometimes found guilty for a crime. And if they say the another alter did it, then legally they address those things. But our mental health system is flawed. It is on the state to prove, in the state of Massachusetts, it's on the state to prove that she is criminally responsible, versus on the defense to prove that she's not. And there to me, there's lots of reasonable doubt. And so I don't know that 12 people are going to agree on this. And even if she is convicted, I think things have happened in this trial where she could have a very, like, this verdict could get overturned if she was for some reason convicted. The whole that statement about her being Catholic and that coming up twice, I do think an appellate attorney, that would probably be their top thing in their brief, um, uh, if she was somehow convicted. Doesn't it make sense that if she was trying to keep Patrick out of the house for a long period of time, she would have sent him to do a more consuming task? And so that's where I'm not trying to help people crime better. I'm not trying to help people crime better. Do you think she may have hyper fixated on medication side effects, and that was some of the reasons she was resistant to taking them? And also, I think she was having legit negative side effects from the medications. I think she got way worse after the first one. I would have wanted her to combine medication and therapy. Often for anxiety, yes, medications can be prescribed. um, Therapy can be very beneficial for anxiety. The medication, I think, made her 20 times, well, made her a lot worse. And that's, it's rare and it sometimes happen. I'm in no way like, because the providers can do everything right, and somebody can have an adverse reaction to a medication. And so I do wish that she had had more in-person visits, but that's just my own personal thoughts. Somebody mentioned that the Commonwealth psychologist interview was entered into evidence. I don't know. So it's the capital M spelled backwards. So in on YouTube, I can't say certain things or the YouTube algorithm gets mad. Does it really matter whether her psychosis was triggered by this or that? I believe I answered it. The biggest thing is understanding criminal responsibility, and that a person can be psychotic and still understand that what they're doing is wrong. That is very clear. I have covered multiple cases where defendants have attempted not guilty by reason of insanity. They had diagnoses of schizophrenia. They were often not on their medication. They did a crime and they were convicted. And there are some states that have guilty but mentally ill as an option. I think California and Nevada are two states that have that, where a person can receive mental health treatment and then serve the rest of their time in a prison facility. But yeah. Do you think she decided that day her pain would end? And so I think the people, so the state experts have testified more about what she says happened that day. All right. Do you think she might have a personality disorder? No, no. So nobody found problematic personality traits. If they had found them, they would have talked about it. And the MMPI can flag problematic personality traits. There were not signs. This seems very related to this instance. This horrible, from September through January. That's what this, versus a personality disorder, would be a long-standing pattern over a period of time and not just related to this one instance. Those are just my general thoughts. But how easy would it be for an intelligent person to manipulate some of the psychological testing? So there are validity measures, there are things that try to get at it. And that's why the psychologist did not allow the recording or publication of the questionnaire, of her taking the psychological testing. I think it was in this case that I think the defense wanted everything to be interviewed, but because of copyright and all of that, there are some things that just can't. Even under seal, you just wouldn't want videos out there available of that. Um, but um, even with the state's experts, I still think there could be some doubt in the jury's mind. Uh, it did come up with Dr. Halburn that, and this was the state's psychologist, that, no, no, psychiatrist? Oh, gosh. Yes, psychologist, I believe. I'm almost positive psychologist, that he would not conduct an evaluation of a patient. And I think this was in direct contradiction to Dr. Zeisel. So Dr. Zeisel, he went immediately after. So attorney Reddington reached out and said that, and wanted him to check in on the mental well-being of Lindsay. And he went and did, just a like, he didn't meet with her and do therapy. He didn't like process what happened or anything like that. But he did go and check on her. And I think the state is trying to present him as being biased. And when he said patient, I think he just meant client, but not like that he was evaluating her. I think he was clear that he didn't perceive anything he was doing as treatment, but I think there should have been a separate treating provider that made recommendations to the court about like what she needed physically. Sometimes you can advocate too zealously for a client, especially in a forensic setting where it can make you seem biased. And I think the state was trying to discredit his testimony, and because I think Dr. Dr. Hellborn, I think, came across almost more sympathetic toward Lindsay. Like, I don't know, like you could just, I don't know, like I thought it seemed like he really, he was evaluating her from clinically, but also just that he's not a robot, and like he could see her pain. And he communicated that to the jury, I think, effectively. And so they talked about confirmation bias, and that's where you make up your mind early about a particular diagnosis. He spent 3 days evaluating her. Day 1 was getting the background with Dr. Mack. Day 2 was testing, and then day 3, they talked about the alleged offense. And I like that he said alleged offense. Doctor, who was it? It was the last expert from the defense, Dr. Resnick, I believe. He kept saying the crime. He kept saying on the day of the crime. He kept calling it the crime. I prefer alleged offense versus like talking about, because when you talk about something being a crime, I don't know. It's just my own personal thing with language, and I'm sitting back getting to armchair quarterback this, and so that's what it is. Is the MMPI validated for assessing how you would have answered questions from years ago? So, Dr. Hellburn, he did talk about that. That is a limitation to giving the MMPI today. Now, there was a separate day that was assessing her state of mind at the time, because I think he still gave the MMPI. Just it's often used in forensic settings. It's commonly used after the fact, and but more went into the evaluation than just that part. All right. I honestly think that there could be a hung jury, but we'll see. Thank you so much. I appreciate you all. All right. So let's see. So then Dr. Halburn, he spent 180 hours prior to meeting with her, reviewing records. and then 10 and a half hours with Lindsay, and then an hour and a half of collateral interviews. And I was glad that a state expert did do collateral interviews because I thought that they made Dr. Mack's testimony. Now I think I don't know, like I think getting more information is better in a case like this because it is so complicated. And they talked about her mental health history prior to September 2022, which was limited, just some anxiety. So, low levels of anxiety can be helpful. So, anxiety isn't at lower levels, you wouldn't even diagnose it. That a little bit of anxiety helps people be on time, it helps motivate people to do things. Too much anxiety can be debilitating and can lead to decision paralysis. It can lead to severe depression. Like too much anxiety can lead to burnout and overwhelm and all of that. And so we want to learn how to balance it. The goal isn't no anxiety, but it's about the anxiety being manageable. And so there were times that Lindsay's anxiety was helpful, but then with the return to work after her third child, it got to the point where she wanted to consider taking medication. And um and then that's where, beginning in September 2022, things her symptoms worsened, symptoms of depression, insomnia, racing thoughts, feeling overwhelmed. By late November, she was having real difficulty with sleep disruption, and she had concerns um all and starting in mid October about the impact of the medication. In December of 2022, she continues to get worse, began to experience horrible intrusive thoughts, including thoughts toward herself. They would occasionally be about harming the children. And the thoughts would say, your brain is damaged. You should just do that to yourself. That was the way that she described them. She did not describe them as auditory hallucinations. And he explained the difference, that intrusive thoughts, they are kind of coming from your own mind, versus auditory hallucinations are coming from outside of you. And intrusive thoughts are still thoughts that you don't want, thoughts that that you try to push away, that you try to fight to manage. He talked about her losing weight, her experiencing tremors, sweating, GI issues, sadness, and severe depression, and that she was not accepted to women's and infants. And the state kind of came back to and actually read, because the defense kept saying that she was over medicated and that's why she wasn't accepted. But women's and infants felt that this was more of a general mental health issue. And now this is according to the state. So the state keeps saying this. So the defense very much wants to say that, like, it was because of the medication and the horrible treatment she received from her providers. That's why she wasn't accepted to women's and infant. And then the state wants to say, no, she was more of a general mental health. They weren't saying she didn't need treatment. They just thought a different program would be a better fit than their program. Right. And so then she has a history of multiple diagnoses, including adjustment disorder, uh, postpartum depression, and that now she's diagnosed with PTSD, which we hadn't heard before, and generalized anxiety disorder, bipolar 2. He just threw out a bunch of different diagnoses. And he talked about the role of medication, severe sleep deprivation, and worrying about leaving her children. He talked about bipolar 2, that with a hypomanic episode, or with mania in general, there has to be identifiable mood swings, an identifiable period where the mood is elevated. And he went with bipolar 2. He talked about the reliability of psychological testing, and that it looks for things like minimizing or denying possible signs of severe mental illness and mental disorganization. There were parts of the MMPI where it seemed like she was underreporting some symptoms. So there were no major elevations on the clinical scales outside of the thoughts towards self and death thoughts scale. And that she remains at a high risk to harm herself. There was he also talked about grief, and that in January of 2023, she endorsed feeling blue, depressed, no interest in things, thoughts of death or dying, hopelessness, um, self-consciousness, and with others, and the idea that there was something wrong with her mind. He gave her the obsessional belief scale, and I wonder if he was trying to see where some of these intrusive thoughts was there obsessive compulsive disorder. Because as people have been talking about things, in the back of my mind, I was like, okay, because sometimes with obsessive compulsive disorder or OCD, there can be these intrusive thoughts that are within that diagnosis, but I don't think that's what was happening here at all. He did give her something to assess those thoughts, and um, and then he, for the evidence of acute psychosis with command hallucinations, what he said is that is what she said happened, thinking that others may know her thoughts. He clarified that he did not think that she was experiencing thought broadcasting, and that her thoughts were vivid and she felt they were loud, but she understood. But like, I don't know. So that's where he explained that part. It is, we all heard it. It is what it is. All right. And then he talked about the evidence against acute psychosis and the fact that she only experienced it during the offense. And he said that it might be a convenient way to lessen culpability. The inconsistency with what she told people suggests inaccuracy, and that she said she only heard one statement. And then I guess she told other people that she heard other things. And then he went into malingered hallucinations research. And I think that the defense, they probably objected right about here. So the malingered hallucinations research. And he talked about how normally genuine hallucinations will come and go. And that this male voice has never been experienced before or after that, I guess, 15 to 20-minute time period, and that she had no control over the voice or her actions in response to the voice. And it is rare that the first time somebody heard a command voice like that, for them to listen to it. So that is common. That, like, normally, so I've worked with people that have experienced psychosis, and it's normally something by the time they're making it into treatment, if they are experiencing command auditory hallucinations, because there are some benign hallucinations and there are some benign command auditory hallucinations that are like, I'm making up, like touch your nose, or but there are some that are very harmful. And anytime somebody is experiencing psychosis, we want to take it seriously and make sure that people are getting the support and help that they need. Um um and let's see. Today they talked a little bit, but they kind of talked over different treatment options, because I heard TMS was discussed, and I had mentioned here that for severe treatment resistant depression. Now, if her real diagnosis, and so she's been able to be stabilized without on low doses of mood stabilizers, and she's on 2 different sleep medications. um but with those medications, because she's no longer experiencing any hallucinations. That was the only day that those hallucinations have ever been present. And once again, as somebody that's worked with people, like, that's just, is it possible? Yes. It would just be very rare that a person would act on those thoughts in the moment. And I think that's why the state brought in the thing of, like, if you heard a voice to, you know, do something, that most people are going to talk about ways that they tried to cope, the ways that they tried to resist. And so, Lee, it's tough. If you are giving opinions, if you can just put "in my opinion," just putting things that you think. No matter what, Lindsay Clancy, for the rest of her life, she's gonna have to live with what happened. I think she'll continue to be a risk toward herself. Even if she is found guilty, she'll still be on, like, a mental health section, because she has lifelong she can't be in general population because of her intense medical needs, because of all of those things, and then also her continued risk to harm herself. Um, she will likely remain in some type of mental health setting, even if it is within a traditional jail setting. The warden might even, like, even if she is convicted, they might still decide to place her in a state hospital that could better meet her needs than a prison. Now, I'm not in Massachusetts. I don't know if that's an option. Okay, I know that in Virginia, sometimes they've discussed, because some of our state hospitals have jail units, and depending on if somebody isn't stable to be in the traditional jail because of staffing and all those things, they will sometimes place the person, even if they've been convicted, they'll sometimes be placed in the state hospital. And so, yeah. Would Why do you think our culture has the misconception that she'll get out if she ends up in the hospital? So I think people think NGRI is a get out of jail free card, and it's not. So it's not. So I think it'll be similar to Andrea Yates, where I think she'll probably spend she might I think she'll stay in the hospital. They would be leery to release her. And then she has a history of not always being completely forthright with how she's doing and how she's feeling. And so they would likely want a longer period of stability. And if somebody is found not criminally responsible due to mental health, they're often um, they're often court ordered to often stay on medication. They're court ordered to treatment. They're court ordered to do all of these things. And so even if they are released from the state hospital after 5, 10, 20, however many years, there are still conditions. And so I don't think that she would get out. What are your thoughts when they say her meds are effective, but she remains on one-to-one? So I think that's her continued thoughts about herself. No matter, there's no medication for that can take away what happened. So there is, and that I think is like the PTSD, and there are probably still parts of her that struggles to live each day and to continue on. Like I think that's real. I think a lot of the anguish that we see from her during the trial, like, it seems real to me personally. But did you hear Reddington ask Halliburton if it would surprise him to learn Lindsay could only grunt to Patrick when he found her after he used wording in his decisions? And so I think the jury is probably going to go back, and I don't know if they'll go back and look at the police reports. I don't know how the jury is going to handle that. I don't know. Um, so if there is, but so the experts have all said that it was bipolar 2 or major depression. The diagnoses given, so postpartum depression is not a official diagnosis. So nobody can it might be a way to categorize things, but it's not a diagnosis. It's not an official diagnosis. And so um uh all right. All right. And you made a good point that they could listen to the 911 call again if that was something that they were questioning or that they were going back and forth about. I don't know that they will. He brought up paratraumatic dissociation. So I love following these things because sometimes you have experts talk about things that I have never heard about. So I've definitely heard about dissociation, but peritraumatic dissociation is a protective mental response where a person feels disconnected from their body, reality, or emotions immediately after a traumatic event. Key symptoms can include depersonalization, derealization, emotional numbing. It often happens as a survival mechanism, can be an overwhelmed brain, and so, but it was just um uh I've done a lot of research with trauma, and I had just never heard that specific thing said, peritraumatic dissociation. And so there are 4 different types of dissociation: depersonalization, derealization, um, identity confusion slash alteration, and amnesia. But yeah, so we like to nerd out about psychology here. So we'll see. Um, so for cross examination, Dr. Halburn, they went back and forth a lot, of course, uh, and they talked about the phone call. They really questioned a bunch of things. I do think that him saying the statement about her religion, I didn't think it was appropriate for him to think about his interpretation of what she might have thought spiritually, especially um, because that whole mortal sin came up again, and um, and that's one of the things that happened where I'm like, ooh, even if she is convicted, like we could be watching this all over again. If the trial had to happen again, I would not watch all of it again. If the state took a different approach, I might watch aspects of it, but I definitely would not cover it the way that I'm covering this one. Um, and so with this, I truly hope that you all take care of your mental health. Okay, pick and choose battles. If we can disagree, everybody is not going to see things the same way. As long as we can do so respectfully, I think that is really key. With this case, if I was on the jury as of today, I I would have more questions. I still have a few questions. I struggle with the fact that the voice was only that day and that it's never been heard since. The jury is not going to have a psychologist on on there, um, and just how everything was played out. If if she did tell the one doctor that she made phone call, like that the voice happened after she got off the phone with Patrick versus in the middle, and that's where the jury, I don't think they're going to get to see that. But if that's how she said it happened, once again, I have more questions than answers. It's on the state to prove that she did understand that what she was doing was wrong. The altruistic filicide that they've been talking a lot about, um, that's where it's not true. I I wish that she had got appropriate support, appropriate help. And that's why I talk about these things, so that hopefully if somebody is struggling with their mental health, that they can know that people care, that people see their pain, and that there is help and hope out there. And sometimes people take it 1 minute at a time, 1 second at a time. And if something isn't okay, to please, please, please talk to somebody. 988 is the national crisis line in the United States. It's so they have crisis counselors that screen things. I heard in Massachusetts that there might be home-based crisis stabilization, because in Virginia we have home-based crisis stabilization, and so I wish that. Would treatment not make a difference in hearing the voice since? But the medications are similar to what she was on when she said she heard the voice. So, and then also a head injury. So I'm not a neurologist or a neuropsychologist. I think the state wants to say she doesn't have a head injury, but the spinal injury, like she had a severe, she had a severe thing that happened. Um, she continues to have thoughts toward herself. Um, I don't know. Like this is a tough one. Um, and she was tried on different medications. So they didn't find the right medication immediately. They tried her on lithium, according to what one of the doctors testified. For anybody concerned about HIPAA and why we're all able to talk about everything going on with Lindsay's mental health. It's because when you plead not guilty by reason of insanity, all of the records that the judge allows in is allowed in. And so going all the way back to however far back a person's mental health records go, all of that comes into the trial, as long as the judge allows it. That when a person pleads not guilty by reason of insanity, and that's why sometimes people weigh like, am I gonna? Is this a defense that I'm going to attempt? Because it is invasive. You have to meet with the state's experts, and you don't have a say in, and a lot of those things, and your fate is now in these experts and then the jury's hand. And so we'll see. We'll see where things go from here. I truly, truly appreciate each one of you. Please, like I said, take care of your mental health as you are following and this case. Take breaks when you need to. Um, the expert testimony, except for when they go back and forth. So I like watching on like 1.5. Honestly, I watch on 2 times speed. So I normally don't watch live, so I can skip through some of the breaks and the sidebars and everything. Um, were you surprised an expert psychologist had no knowledge of? So not necessarily. So that's um not not because I think let me see. Because I think he understood the concept, he just didn't know the wording for it. So that's more within psychiatry, I think. Let me see. Let me make sure I type the word correctly. Yeah, so that would be more within psychiatry. So in psychology, I've sometimes heard of different language used because even I didn't know that word. I had to Google it. So yeah. All right. So we will see what happens tomorrow. I believe closing arguments are going to be Thursday. Please, as the jury gets the case, breathe. I think they're going to take their time. I think at least 2 days. I don't think the jury is going to be sequestered. I think they'll get to go home for the weekend. I don't know if they have the choice to deliberate over the weekend or not. Some juries are given that option. Some because courts close on Friday. Some they have to come back on Monday if they haven't reached a verdict by a certain time. I suspect that this could take a while. Okay, so please just bear with it. And this will be their first time getting to talk about it. Getting because they are not able to talk about what's happened, to talk because I just need to debrief the the lawyers and the judge and the witnesses being reprimanded. I don't know. Like I would have to talk about all of those things as well. But I so appreciate you all. Be kind. Don't do crimes. And I will do you all. I will see you all next time. Have a good one. Bye.